The Allied Health Assistant Trainee Program at CGHS is all about taking 5 individuals from our community and training them to be allied health assistants, which will help our workforce and ultimately help the community.
We couldn't provide enough allied health service, so we couldn't meet demand. And the other really critical driver was we were out in a market, if you like, for allied health professionals that we couldn't compete in.
Mostly within health organisations, we understand about university-based training for the professionals, but there is also a very large workforce that is supported by vocational education.
This project is really looking at how you build capacity and capability. The idea is to see our local community as a resource and bring entry-level people into the profession.
Frank ultimately applied for, and we were successful in gaining a workforce innovation grant from the Department of Health.
Basically it was about talking to the department about what we were trying to do and basically filling out a funding application along the lines of what met the criteria. After getting the funding, it was a matter of presenting a much more detailed and time-specific project plan. To bring a new category of worker into the workforce, the governance issues are fundamentally important, because the biggest concern, if you like, of the tertiary trained allied health workforce is what can the worker do? How are they going to be supervised? How do we make sure things don't go wrong?
The steering committee is made up of our CEO Frank Evans, myself, the Allied Health Department heads, and we also have one of the AHAs who is fully employed by CGHS and not a trainee.
My role in the steering committee involved attending the meetings, and then from a dietetics point of view and a manager's point of view, inputting into what direction this project could take.
Some of the key milestones that we were very conscious of meeting was the recruitment of the AHAs, the recruitment of the project officer. We had about 30 to 40 applicants for the actual AHA traineeship.
As the project officer, Denise sent all the applications over to us. There was about 18 that we thought met the criteria.
What we were looking for were young people who were able to work within a health environment, who had a genuine interest in trying to help people, who were looking at career growth, and also who demonstrated a level of communication skills.
So we employed 5 trainees. They started last November, and we expect that they'll be training for between 1 and 2 years, but closer to 1 year.
They had a 3-week orientation program. It involved a lot of meet and greet, a lot of observation, a lot of the more tangible nuts and bolts of what they needed to survive within the area.
I think they were a little bit overwhelmed at the beginning to come into quite a big allied health department, which is all set out together. But I feel as the Allied Health Department here is all based in one area, they've integrated well.
Once we had them orientated into the organisation, then we could start the online learning.
Well, we partnered with the Australian Institute of Flexible Learning, or AIFL, mainly because, well, for 2 reasons. They're a public health service, so that's good, and so we partnered with them, but also they're committed to developing flexible learning, and that's what we need. We do not want our people having to go away to learn, so we needed a registered training organisation that could provide the qual, provide good content, provide a lot of it online.
In terms of my role, week to week or daily contact with them would be, for example, in the computer lab.
The actual trainees can go into the computer lab and do the online learning themselves. Each module gets opened up as they come up to it, ready to do it.
If there are any questions that they're having, I'm able to talk them through it or demonstrate, which is a bit different to just the online aspects of it.
They can also access the AIFL at home. The other things that were very important was developing the clinical rotation calendar and getting that agreed to with the allied health managers, and then commencing the allied health trainees on that calendar.
At the moment, what we've done is we've got 5 main disciplines, so physiotherapy, occupational therapy, speech pathology, dietetics and social health. And what we've done is attached an allied health assistant trainee to each of those departments for a 10-week rotation.
As far as dietetics is concerned, we're using them a lot more in the monitoring side of things. So we'll assess, the dietitians in the department will assess a patient, and then the allied health assistants will be more utilised in monitoring them.
In physiotherapy, the allied health assistant trainees are involved in groups. They're an extra pair of hands to assist the physios and occupational therapists in that area. And also on the wards, they are involved in patient treatment themselves, so they're able to, once trained, see patients for mobility, carry out basic exercise programs, and also setting up other equipment for us to use on the wards as well.
Often when you want to enter a career in the health field, you're not sure dietetics, physio, occupational therapy, you're not too sure what to go for, whereas they have a solid understanding of each discipline because they would have worked with each one of them.
I think they've developed hugely in their professionalism. They've taken on board a lot of the learning and direction that they've been given by the other allied health professionals. It hasn't taken very long at all for the departments to start to rely on the allied health assistant trainees.
Once this group of trainees finish their traineeship, we will be looking to employ most or all of them into our workforce. There is then a pathway already for them to university to a new degree called a Bachelor of Rehabilitation Science. So that's one opportunity that's opened up already through Charles Sturt University. Next time we'll know better things like which units to do first, what should be done prior to the first clinical placement.
One of the things that we noticed was that the actual orientation and the education to commence wasn't probably as good as it should have been. So we're going to, instead of give them a 3-week orientation program, we're going to introduce them more as a study block. We found that they actually needed a lot more theory to start with.
This is the future of learning for rural health. We need flexible learning models. We have to partner with learning organisations that can deliver flexible learning for us.
From my experience in health, what we have developed here at Central Gippsland Health Service has been an enormous eye-opener, not just for us but also for the actual trainees. It has delivered to date everything that we have asked of it and more.